extend the head. Now, what do I do with the bottom part? I let the leg come out and I extend the toes and dorsiflex the ankle. So now the nerve is being pulled this way.
Hey everyone, this is Dr. Perry from Stop Chasing Pain, and you're about to see a small little video excerpt from one of my courses that I teach called Nerve Mojo, where we teach people about the nerves of the body, how they're interconnected, but how you can do what's called tensioning nerves, uh, which is where you put increased tension in both ends of a nerve. One, which is called slacking, where you relax the nerve itself. So both ends of the nerve relax towards each other. And then you have what's called flossing or sliding and gliding, where just like using dental floss in the teeth, one side will go longer, one side will get shorter like this. So it moves the nerve along its pathway where it can get stuck. All right. Now, the important thing when you're going to watch this video is I'm going to demonstrate a tensioner first. A tensioner is where you're going to have optimal stretch in the nerves. If you have a hot sciatic nerve, you will likely not like this one, okay? But I want you to try to get into it to see where your threshold is, all right? But I don't want you to do that one when the nerve is hot, as the recommendations to try to get it to not be hot. Does that make sense? We're going to do more of the relaxation one. Now, the relaxation one is where we're going to put slack in it. And you'll see that's the second move, where both ends of the nerve from the lower back to the foot relax towards each other. You'll typically like this one on most people. You can absolutely get into that position and just relax there to take some pressure off of the nerve. Then ultimately, we want you to do the flossing, sliding, and gliding. And this is going to take practice. You'll see by moving the head and how you slump your posture, how you straighten your leg, your knee, and using your ankle and your toes to tension the nerves. That's the optimal one that we'll want to go for. Now, the goal in the end is to have nerves that can do sliding, nerves that can do slacking, and nerves that can tolerate tension. Okay, because healthy nerves should be able to go on tension for a short period of time. Because if you keep anything on tension for a long period of time, it's going to hurt, no matter what structure it is. All right. But the goal is to get to a tension one and say, wow, you know what? The first time I did a tension one, that really sucked. But now that I did the flossing one, this is easing up. So you need to be able to explore all three of those, because that's how the body functions in real life. And that's what nerves actually need to do in real life when you go through daily patterns of movement. Okay. So a key thing coming on up is showing you things to look for, recommendations on repetitions. Also, different variations of moving that nerve, okay? But do what's best for you. Don't push yourself too much into pain. And I hope it helps you feel a bit better. And remember, always do both sides. All right, here's a graphic of what the sciatic nerve pathway looks like going down your leg. Obviously, you have one on the right and one on your left. And you know, if you've ever had this, it sucks. And you can feel pain or discomfort anywhere along this pathway. These are sensory innervation colors. This is where you may feel tingling or numbness or pins and needles or a change in sensation. What I want you to notice here is that all these nerves have different names that you see here, but forget about those, because in essence, all it is the same nerve just spidered off into smaller branches. So I actually use the reference of a spider web, where if you pull one part of the spider web, all the rest of the spider web feels it and goes with it. And that's the same thing with the sciatic nerve. Now, I'm going to go over some of the common places that this nerve gets irritated, where it doesn't glide well. Right? Now, what you can't see is the lower back itself. So look at my mouse, move this circle up here. in the lumbar spine is where you can get issues actually at the root itself. Most often you can have that with disc herniations or irritations or inflammation in the lower back. The next place you're going to get it is where it exits down into the buttock muscle by the sacrum here, right there, called your sciatic notch, right here, basically in the meat of the muscle. And then the next place it gets is on the outside of the sit bones. When you sit down on a chair, you should feel these two big bumps, one on your left, one on your right. It's called your ischial tuberosity. You don't need to know that. But I want you to see that it travels on the outside of that, in between where the femur is, right? The leg bone. Then it comes down into the bottom crease of the buttock, right down the hamstrings, and above the crease of the knee is where this nerve splits off and goes and becomes all these other smaller branches. Big places where there's tightness or tension that these glides can help are anywhere from the lower back to the sacrum to the crease of the buttock, mid hamstring, and right above the crease of the knee. And then, of course, mid calf, right in the middle of the calf. Is one reason why calves get really, really tight. And another powerful spot is on the inside of the ankle joint right here. Okay. So what I usually have people do is they do a little massage along this pathway, and then they can start to do the glides that you saw in the video. All right. Now, a few things I want you to watch for in relationship to doing this movement. All right. One, you're probably going to feel this. You won't have, if you have a hot nerve, if you have a nerve that's lit up and inflammation, you're going to feel it. Okay. But that's not necessarily a bad thing in order to try to heal. So I need you to go look down the bottom. All right. Do not rush. Do not go too fast. Go smooth and easy. And it's about the coordination and the rhythm. You may have to shorten up your ranges of motion, which means you may not be able to bend your head forward a lot or bend it backwards a lot or straighten your knee out a lot or bend it back. Bend it back usually not a problem. But the ankle, I need you to play with those motions and take yourself right to that edge. All right. Don't stop breathing, because you're going to want to stop breathing. Whenever you put the nervous system into a state of where it's on the defensive and it's pain or it's in fight or flight, which it will be when you have had pain in there for a while, don't stop breathing, because if you stop breathing, that's just going to make things worse. So monitor your breathing in and out at all times. Okay. So like I said before, it's normal to feel symptoms increase for a bit, but if they do, they shouldn't last longer than 15 minutes after you're done with the motions. If you feel that it stays there, discontinue it. You may not be ready for these yet, or you have to do a lot less of them, or you need to start on the non-symptomatic leg first. So let's go up here. The reason you start on the leg, that is non right here. Okay. Non-symptomatic leg first is because when you work the side that doesn't hurt, it has carry over to the side that does hurt, because the two sides of the body talk to each other. So when you move, let's say your right sciatic is bothering you, start on the left-hand side with these movements, and you'll likely feel that the right side feels better because of stuff you did to the left side, because the tension goes from one side to the other side. And the next reason is that your brain and your nervous system will see that you have the ability to move the other leg without pain. So it lowers your threat response, your risk response. So it says, you know what? Hey, man, we've actually can move on this side. I feel comfortable with this, and it can lower your threat response, like we said before. So when you go to the side that hurts, your nervous system may take the brakes off, which means allow you to move, because it knows it has the possibility to move on the other side. Does that make sense? That you tiptoe into the other side. I guarantee you, if you do the non-symptomatic leg first, or definitely with the painful side, you will notice a difference. Now, in relationship to how often, First of all, that's individual. There's no magical unicorn, perfect amount of sets, reps, pace, speeds, anything, or positions. Some people like to do this seated. Some people like to do it lying on their back. It's up to you. I'm only going to show you the seated version in this one. But start with about 10 cycles of the flossing when you see it. Hold each end point about 2 to 5 seconds when you get there. Work up to 25 in a single session if you can, right? But you need to play around with these. Maybe you can only do 2 or 3. Maybe you can only do 1. Then you just keep revisiting it, and hopefully this begins to improve a little bit and you feel a little bit better, okay? Because the idea is that you should be able to floss both sides of these nerves, no problem, easy peasy, without having any issues. That's the goal, okay?
Coming out that lumbar spine here. Then it's going to come out and go down by that sacrum. Right here's a sciatic notch. Ischial tube down my leg. We know what? If I slump, if I round forward, I stretch the spine. If I flex my head down this way, I stretch the root. That makes sense? How would you stretch the nerve in the back of the leg? Would you straighten the leg or would you bend it? You would straighten the leg, right? How would we tension the sciatic nerve at the top? You would flex your head forward and you kind of slump a little bit. This is called a slump test, like this. So it's stretch on the back. Then what I would do is straighten this leg out, and now you're stretching the nerve behind the knee. Then you would dorsiflex the ankle, extend the toes, and now you're optimally stretching that sciatic nerve here. And that's the one when people have a hot nerve will not like it. So that's how you put tension on it. How would you relax it? You're going to flex the knee, relax the foot, then you sit up taller, and then you extend the head, and now you've got what? The relaxation part. Now, how might you, let's go into tension one more time, and then we'll talk about how we can floss. So that's tension, and then everything reverses. That's relaxation, right? So let's say I want to have relaxation at the spinal part. I'm going to extend the head. Now, what do I do with the bottom part? I let the leg come out and I extend the toes and dorsiflex the ankle. So now the nerve is being pulled this way, away from the spine. Now, what happens if I want to reverse that? What do I do? Then I do that, right? So now the tension is at the back and the relaxation is in this one here. And then I would reverse that. Floss down and reverse, floss up, floss down and floss up. Now that you know what that position is, you can actually do that lying on your back. I'm not going to show you that here for time's sake, but you just mimic that position with wherever you are in relationship to flossing the sciatic nerve. Okay. And same thing with both sides. Right? That's pretty straightforward.